All right, well, thank you so much for joining us today. My name is Megan Hotelling, and I'm the Community Engagement and Events Manager at Aquifer. Aquifer, a nonprofit founded in 2000 by health professions educators, provides students with access to virtual patient cases and a comprehensive learning system created by an educators consortium covering core rotations and clinical excellence topics while incorporating assessment and content. I'd now like to introduce our presenters for today's session. Joe Miller works for Aquifer, supporting programs and educators using Aquifer's content more effectively. Dr. Kim Tartaglia is a certified coach and professor of medicine at The Ohio State University Wexner Medical Center, where she serves as academic director for the Med 3-year program and director of faculty mentorship. Dr. Tartaglia is also a founding member of Aquifer's peer trainers and the current editor-in-chief. The peer trainers are a special board within the Aquifer Consortium designed to support programs with tools and professional development aimed at improving the adoption and use of Aquifer's content, assessments, services, and other resources. Cindy Lord is a seasoned health professions educator and dedicated Aquifer volunteer. She has served as an associate professor at Case Western and founding director of their PA program. At Aquifer, Cindy has spearheaded key initiatives, including the PA Task Force and Peer Trainer Board. She was instrumental in developing Aquifer's Anyone Can Coach framework. Kelsey Doherty, an assistant professor at the Child Health Associate Physician Assistant program at the University of Colorado School of Medicine. She specializes in infectious disease medicine and is actively involved in health professions education. Kelsey is a member of the Clinical Excellence and Adoption and Use Boards at Aquifer. Now, I'm happy to turn it over to Dr. Kim Tartaglia to get us started.
Thank you for having us today. I'd really like to start with kind of our objectives for today. I'm going to first provide you a brief overview of Aquifer as I see it as an educator and include its mission, products, and services. And then I'll introduce a framework by Dr. Jeanette Garacio on how to address learner challenges. There we can highlight a few resources, and Joe will do a short demo that shows specifically how Aquifer resources can be incorporated into your remediation strategies. And last, we've invited Cindy and Kelsey here to show how they use Aquifer with their struggling learners. Those real-world examples and insights will illustrate how Aquifer can be integrated into your curriculum to enhance student performance and program outcomes. Let's first dive into our first topic. Aquifer was founded in 2006, as Megan mentioned, and it's a mission-driven organization dedicated to delivering the best healthcare education through collaborative development and research into innovative, high-impact virtual teaching and learning methods. And we couldn't do what we do without the tireless work of the staff. And alongside them is the Aquifer Consortium. This consortium brings together medical and health professions educators from across the country and various disciplines. This consortium collaborates to innovate and create the highest quality content, ensuring that the pedagogy, the learning tools, and the assessments support best practices for teaching and learning. These experts work diligently to keep the content up to date and accurate. And these educators represent partnerships not only with their institutions, but with these national organizations. The content outlines that are put forth by the organizations you see on the screen serve as a foundation for all of Aquifer's content, which is conceived, created, and maintained by this small army of volunteer educators. So every case, every assessment item, and every teaching resource is developed and sustained in this manner. In the Aquifer learning system, we start with the content library you see on the top left, more than 150 cases in the core content and complemented by foundational science content through integrated illness scripts and interdisciplinary topics through our clinical excellence threads. We've married that with the formative assessments through self-assessments and Calibrate. And then internal medicine also has the clinical decision-making exam. In the cases for Aquifer, communication is modeled, questions are embedded, there are deep dives and links to references. And noted earlier, these are peer-reviewed and really continually updated on a cycle of about every 18 months by the expert medical educators in the consortium. Aquifer cases walk learners comprehensively through each step of a patient encounter, from history, physical exam and labs, developing a differential diagnosis, ordering additional studies, and forming a final diagnosis to treat and manage the patient. We'll show you what this looks like in the demo, but these cases are in-depth, interactive, and engaging. And along the way, you basically function as a virtual preceptor. So you can't be there with every student and every learning encounter. And that's where Aquifer sort of fills the gap that you as a preceptor, need. Now, the students can ask questions and check their knowledge through these self-assessment questions. And so it's a way to not only precept, but then just check themselves as well. Here's the list of the library cases. As you can see, it includes cases aligned with the national curriculum in family medicine, geriatrics, internal medicine, neurology, pediatrics, and radiology. We'll talk more about the clinical excellence case sets and the oral presentations, and know that the first set of OB-GYN cases are launching next month. Here is a breakdown of the clinical excellence cases, something that I think would be really helpful in working with struggling learners, and we'll talk more about that soon. These are clinical excellence cases are focused on interdisciplinary topics that are historically hard to teach, especially in fast-paced clinical encounters. I know at Ohio State, our students are consistently asking for more content on high-value care and social determinants of health as well. So whether you introduce these topics in preclinical education formats or you reinforce them during either the core or advanced clinical rotations, they can be a great complement to your curriculum. And lastly, Aquifer has recently released something called Integrated Illness Scripts. It's a bank of 41 illness scripts focused on causal mechanisms underlying common clinical conditions that are designed to support cognitive integration. So that's bringing it all together through these concept maps. They're accompanied by a range of fully developed activities that you can either implement in a classroom or a clinical setting to help your students make needed connections, drive the active learning that is so important for lifelong learning, and lead bedside teaching discussions. Before I now switch to talk about Dr. Gracio's remediation recommendations, I'd like to do a poll question. Megan, can you launch it? Have you ever used Aquifer in remediation? We'll give it a few more seconds. We have at least one person who does it frequently, and then others who have not, but either are familiar with it or are just getting acclimated to Aquifer. So hopefully that brief introduction will introduce you, and then Joe's demo, I think, can kind of solidify some things about how Aquifer can be helpful. But before we do that, I want to talk about moving on to how we can leverage our strategies as educators in remediating clinical learners. And this book Jeanette Gracio wrote on remediation of the struggling medical learner is a really helpful resource to providing structure for both diagnosing and addressing learner issues, which can be crucial to ensuring that we meet all of our necessary competencies in medical education and health professions education. So helping our struggling learners is not just a matter of academic performance, as you know, and it's really crucial that we invest in remediation. Some reasons for that is that struggling learners require a lot more time and effort from faculty and clinical teams, whether it's doing extra teaching, correcting mistakes, providing feedback, etc. And if we ignore these issues that our struggling learners have, it will negatively impact team morale. I can imagine and think of an example of, during COVID when we were rapidly iterating and changing our curriculum to meet students' needs. And when we made a misstep, how that negatively influenced student morale and kind of morale of the curricular leaders as well. Additionally, the performance of learners reflects on the reputation of your educational program. If we poorly manage remediation, it can impact how our program is viewed both internally and externally. And of course, without proper intervention, these deficiencies aren't going to go away themselves. Struggling learners need some assistance in resolving these sort of opportunities and challenges. Finally, I think we all know we kind of have a moral and ethical obligation in health professions education to make sure that our learners are meeting competency. Otherwise, the potential negative impacts on patient safety, quality, and quality of care is it can be substantial. Proper remediation ensures that all future healthcare providers deliver high quality care. And I already mentioned the obligation, not only to society, but obligation to our learners. It's of course easy to teach people who get it right the first time and make our jobs look easy, but we do have an obligation for all of our learners. So Dr. Gracio, I love that she highlights that our commitment to remediation is a reflection of our commitment to excellence in medical education and patient care. Addressing the needs of struggling learners is essential to the success of our educational programs and, more importantly, for the well-being of our patients. So if we think about the framework for areas of difficulty, you'll see that these align very similar with common core competency domains. This aligns with the ACGME's core competency domains required for entering residency, and I suspect that it's very similar across all health professions education. Medical knowledge, patient care, interpersonal and communication skills, professionalism, practice-based learning and improvement, and systems-based practice. And Dr. Gracio added mental well-being, recognizing that addressing the factors associated with mental health and resilience is an additional yet equally important competency for our learners, underscoring the importance of overall well-being. Now, in the book, I highly recommend it. It provides detailed examples of the types of problems learners encounter in each of these areas and ways to address it. Now, each of them can be done through targeted remediation strategies. And what we're going to talk about here shortly is how Aquifer has resources to help support this framework. Whether it's helping to fill knowledge gaps, improving clinical skills, or developing clinical reasoning, I think that's a classic example that will easily come to your mind. But these cases can also assist with competencies such as professionalism and ethical practice, and we'll show you an example soon. Overall, Gracio's framework is a comprehensive guide for diagnosing and addressing learner concerns and providing that structured approach, as I mentioned. By integrating these principles with the resources and strategies available through Aquifer, I think you can offer and create a robust support system for your struggling learners. Before I go into that, let's do another poll question. I'm curious which area represents the biggest challenge for remediation in your program. I know what this answer is for our program, but I want to see how it compares. I'll give it one more minute. It's not a slam dunk like I expected. Hopefully you can see on the slide here, about 40% say professionalism is the biggest challenge, and that is certainly a challenge for us. I think not only in recognizing, but also remediating it. Practice-based learning and improvement and medical knowledge are about a quarter to a third, and then interpersonal communication skills. Great. Well, I'd love to talk about some hidden gems that Aquifer has to really help in these various domains. The first one is the trauma-informed care. So if you're thinking about a learner who is struggling with communication, especially with patient-centered communication, the trauma-informed care virtual patient cases can really help. It is patient-centered communication for and understanding maladaptive coping behaviors that our patients may be employing. It helps to promote patient understanding, effective communication with diverse patients, and sensitive communication when a team member has experienced trauma. These can all sort of enhance the ability to explain adverse events or maladaptive behaviors and improve the overall patient interactions. The next one is the oral presentation skill set. And this is a free material. We actually use this with our learners who have taken time off of medical school before going into the clinical years as kind of a refresher and almost like a boot camp designed to develop oral presentation skills for healthcare providers. It emphasizes the importance of communication and quality patient care and teaches and helps our learners present cases effectively, showcasing not only their clinical thought process, but also their other related skills. A study published in Academic Pediatrics actually showed this course to be as effective as in-person teaching, enhancing learners' ability to convey complex information clearly and confidently. The next one, cases and social determinants of health and palliative care highlight the need for strong interpersonal skills. And so there are teaching points such as building trust with patients, employing cultural humility and communicating with patients and their families, respecting cultural differences within the interprofessional team, and using problem-solving skills and shared decision-making as all examples of how you can improve interpersonal skills. And I mentioned before a hidden gem with the radiology case number 18. That module has a component of both professionalism and ethical decision-making that helps medical students develop the essential professional attributes and accurately communicate critical findings, emphasizing the opportunity to remediate lapse in professionalism by reinforcing the importance of integrity, patient privacy, and ethical behaviors. Now, the diagnostic excellence is a part of the clinical excellence case set, and it includes 7 cases on foundational content about diagnosis, contributing factors to errors, and strategies to avoid errors. The cases and the causes and consequences of diagnostic errors are discussed in detail, and students can reflect on their own experiences. It also provides tools to help mitigate diagnostic error, which is so important for any diagnostician, and is cross-disciplinary. So it is applicable to internal medicine, OBGYN, psychiatry, family medicine, etc. It's really an excellent resource for students struggling with the practice-based learning because it discusses systems for receiving feedback on patient encounters, calibrating your response to diagnostic errors, and it introduces the role of metacognition in preventing and learning from errors, as well as identifies clinical decision support tools that can help reduce diagnostic errors. And finally, the high value care case, it is really, I think, a very high yield set of cases for us at our institution. It has 12 cross-disciplinary virtual patient cases that can show how decisions on diagnosis and care can impact costs and efficiency. And it really aims to integrate high value care into clinical practice. Again, if the student is struggling with evidence-based practice and incorporating that into clinical care, that is a strong foundation of this content. So again, we think of high value care as maybe an advanced skill, but it really can tie in nicely with evidence-based medicine. It also addresses challenges in resource stewardship, team steps, and using evidence-based guidelines, as well as identifying strategies to how to bring value into our patient care. And I think Joe or Megan are going to put a handout in the chat that aligns some of the competencies with these hidden gems and resources that Aquifer has. I'll hand it over to Joe to demo parts of Aqueduct now.
Thank you, Kim. I see that from the first poll that about half the people, this is their first introduction to Aquifer, and about half people are familiar with Aquifer and remediation, and a little bit with remediation, but haven't used it before. And so we're just going to pop into the platform really quickly, and I'm going to show you where to find some of these things, because I think sometimes one of the things we think about is these things are easy for me to find because I'm here all the time, but not probably that easy for if it's your first time in or you're just sort of mildly familiar with it. So it doesn't hurt to talk about this for a moment. Okay, so I'm going to be looking over to my left a little bit because my screen's over here, and every once in a while I'll get confused because it's also in front of me, and I'll be trying to work on both of them simultaneously, but I'll be looking to my left. So when you come to Aquifer, you have what we call the landing page, and then within the landing page, you have your custom courses and regular courses. My screen will look a little different than yours likely does, just because of my permissions, and also because of the content you subscribe to may be a little different. But one of the things that I want to show you is just sort of the idea behind what our courses are. So as Kim mentioned, these clinical excellence case sets sit up here. And so if you subscribe to any of these, like trauma-informed care, palliative care, high value care, diagnostic excellence, all of which were mentioned, these are up in this area. For each case set, there's a set of educator resources. That's this rectangular button here. If you click on that, each case, it'll take you to a guide for that set of cases. But we're just going to go down in here, and here's the core disciplines. Right now, I have all of them in here, so I'm going to go to family medicine. This is, I believe, our most common or second most commonly subscribed to course. So one of the things that I think is important for you as an educator to know is that when you go to these courses, if you subscribe to family medicine, you will have a view like this, where you have the case as it's presented to the student. So the student will see the same thing. Family medicine 1, 45-year-old female wellness visit. we know what this is. But in all these other cases, it's not revealed to the student what the final diagnosis is, just the presenting problem. But you as an educator get information on the side over here. And this can be really valuable to you to knowing a little bit more about the case before you assign it as a remediation case. So if you go in here, you can see like it says, the synopsis. So you get a quick synopsis, you get the final diagnosis, and then you're told if there's any clinical excellence curricular threads. So are those any pieces of clinical excellence that are brought in there as well? These can be really useful if you say have a student who needs high value care and you're looking for a case to put them in. You can find these curricular threads. I can show you where we'll find those as well. But the other thing is this case summary. And the case summary is really what gives you what the teaching is that happens in the case. Let's see, I have to share this tab instead. And I have to make that a little larger so you can see it. But you have access to this before the case. The students get this at the end of the case. So once they've completed the case, they have access to this and can use this to study from. So if you think about remediation, you've assigned to them a case that has some content in it that's really important for them to know, they now have a resource. And these are typically anywhere from 5 to 10 pages long and include the teaching points within them. So I'm going to switch over here and I'm going to share this tab instead. So I'm going to go back here. One of the things we'll refer to is gated versus ungated content. And I think this is also important for you to know. When a student enters into this platform, they go through the case step by step. So they don't get to see the end. And so when you assign them a case, you can sort of pick points within the case by going in there ahead of time and saying, you know what, I want you to stop at a card. Now they can work up to this card and I'll show you what this looks like. We'll go back into the same case I picked before, Family Medicine 4. Maybe we'll go in there. Okay, here we go. And once we get into this case, what you see here is these dark blue pieces. We call these cards, and they all have kind of a category, which is history, physical exam, clinical reasoning, and so forth. Within these, a student will only see this card alone, patient dashboard, when they step into the case, and it'll be open like this. They have to continue to the next part. So one of the things that we often recommend about remediation is like picking a point at which to stop in the case so that then you can have a conversation with the student about that before they move on. So you might pick, going up through history and physical and having them actually stop at the summary statement, which is this first bit of clinical reasoning. And then you could do that together, or you could just say, stop at that point, and then we can review how that went for you. So if you're picking specific cases and spending time with students on that. So that's a way that you can use these cases. We have a couple of links, I think, Megan. One is about seeing cases as standardized patients that we're going to put in the chat. That's a link to a blog. And then there's another one about case summaries and using the case summaries and learning objectives. And we'll put those in the chat as well. These are just write-ups that people have done on our blog about how to use some of these tools. My former boss and the former chief academic officer at Aquifer used to say when her job was remediation at the University of Washington School of Medicine, she used to say, you should pick about 6 cases. So she had this kind of rule of thumb. Don't deluge the students with cases, but start with picking with about 6 cases. And one of the things that she also would say is, we often pick the same cases. And so it's sort of getting to know a few cases that serve problems that students have commonly. So if it's about clinical reasoning, many of our cases deal with that. So if you have 6, 10 cases that you know pretty well, those are easier to pick. And you can learn those again by looking at the case summaries. One of the things in here is that this summary statement piece right here. So this, when the student sees it, this is actually closed. This gives them some guidelines. And then when they're done, they get this answer comment. When the student does this, they actually have this opportunity to receive feedback from an AI engine. This one isn't showing it because it's already been submitted, and so they don't get the option after it's been submitted, and it doesn't show their feedback. But whatever they submit here is also submitted to a report. So one of the things you can do is you can say, hey, I want you to work on a couple of cases. Here's the cases I want you to do. I want you to think about what you're going to write in the summary statement, and then I'm going to take a look at the summary statement that you've written, and we'll work on that together. And we'll talk about that. And so I'll show you where to find that in a moment. But before I do that, I'm going to show you how to find cases. So if we go back to the left-hand side here, you can see where it says we have our tabs on the left-hand side. I'm going to go to the home, but the place I'm going to go is content library eventually. So I'm going to go home first and just show you how else you can find the content library. I think I'm going to go home. Yep, I am. Okay, so the content library is also right here. So this is searching the content library. So we're going to go search the content library. And so once you go to the content library, what this allows you to do is start to find cases that might address the issue that your student is having. So maybe I didn't press the button. And so we have some filtering in here. And then once you pick the cases, then you can add them to a course, which we call custom courses, and assign those directly to students. So you might go in here and you might search for something like, let's see what communication comes up with. I'm assuming a lot. You can see that it's loading down here, which tells me it's searching. I also have a couple of filters set. I'm going to take those off. Cardiovascular doesn't matter, and adult doesn't matter. So I'm going to take both of those off, maybe. It's up there it goes. Now it's letting me take them off. Okay. So if I just search communication, I come up with 42 matching items. So you can start to go in here and use this keyword search to find different items. And then you can see here what it tells me by this, by having these highlighted, is that the term communication was found in the learning objectives. In this case, it was found in the synopses. These light blue ones are integrated illness scripts. And I'm guessing that communication that it's finding is something about cell communication, which may not be the type of remediation you want, but this is what the where the synopses can be really valuable. So you can go in here and look through and find these cases in this way. You can also, if say you're a only in family medicine, you can just select family medicine there, and it will only return the family medicine cases that come back with that term. So here we go, family medicine. These are family medicine relevant cases. So let's imagine that I found a couple of cases and I've said, okay, given my student's issue with communication, here's a couple of useful cases for me to assign. I can then go in here and add these. And so you just click add on these and you see how now it says remove. That means that I've added it to a course, add. And at the very top, it says create custom course. And what's really neat about this is that you can create a custom course and then add a student to it. So if you've decided, okay, I want to do these couple of family medicine cases, maybe this integrated illness script, and maybe the oral presentation cases, you can add those to a single course and then assign it to the student, and it shows up on the student's dashboard and says, hey, you've been assigned to these cases. So it's an easy way to communicate and for the student to keep track. So let's go back for a moment. And as I mentioned earlier, you can look at a student's summary statement. So let's talk a little bit, once you've gotten in there and you've found some cases that are useful to you, you've looked through the synopses and the case reports, you've created up a custom course. Now we have Amy's test course, and she's put a few students in here for remediation. And now she can just easily click this little button here that says view report. And there I am remediating Family Medicine 8 and several other courses, palliative care. And in here, what you can do once you're in here is you can start to see how the students are progressing through the cases. So it's a very simple report to go through here. And then on top of this, you can click into these, or you can click into me and see how I'm doing. So I can go into Joseph Miller, JTX at Gmail. And let's just see how I did on this So here I go. So in here, as I mentioned earlier, one of the good places to go through a case and a good break point is at the summary statement, because it's an actual clinical reasoning stopping point where the student submits it, it shows up in a report. You can see I've worked up to that point. So it took me 2 minutes to get there. I went through 8 pages. That's where I was told to stop. I submitted my summary statement, and next to it is the expert summary statement written by the case author. So if you were choosing to sort of say, hey, look, Joe is working on clinical reasoning. Let's do a couple of cases in family medicine. I want you to work up to the summary statement because that's a good proxy for your clinical reasoning. It'll show up in this report. You can look at that, and then you can have a discussion about that process. So we provide that tool as well. And so then the last thing that I'm going to mention before we bring on Kelsey and Cindy to talk about their experiences with remediation in Aquifer, I'm going to go back over here and I'll mention that we have some assessments that you can use. And Kim mentioned in the early part that we have Calibrate, which we call a formative assessment. And we also have the CDME, which is the clinical decision-making exam, which is seen as a summative assessment, but could be used in a variety of ways. And that's an internal medicine exam. And the way that you set these exams up, you can see I have some set up on my dashboard here, but the way you set these up is on this board over here. See where it says assessment, you click on this, and these exams can be given twice during a clerkship, or you can use them for remediation. So if you have a student who has struggled, you could say, okay, we're going to do a Calibrate exam, and you can use that to actually start to think about your study plan and how you're going to set up a study plan. And in fact, during the pilot, the first year that we were just trying this out, when we had kind of a stick figure of an exam set up, one of the main things that people contacted me about was like, can I use this for remediation? Like, can I give this to a student who has failed their end of course exam and just see if it helps them study? And it wasn't a use case that we had planned, but it certainly is a use case that people have decided is important. And so you can request those up here on this blue button. And to have access to Calibrate, you need to have access to pediatrics, internal medicine, family medicine, or radiology at present. So one of those 4 courses. And then starting in July, neurology will also have a formative assessment. And then to get access to the CDME, which is, by the way, a very cool exam. You will also have this blue button if you subscribe to internal medicine. So that's the other exam we have for internal medicine, and also an excellent clinical decision-making exam that can be used as a summative, or again, could be used to find some gaps in a student's performance and help them create a study plan. All right, so that is the platform. And I am going to stop sharing for a moment, and I'm going to go back to the PowerPoint. Alrighty. All right. So I want to welcome Kelsey Doherty to our webinar today. And Kelsey and Cindy Lord are also going to share their stories about using Aquifer to address the needs of struggling health profession students. Kelsey is here from the University of Colorado to talk about how she's been using it. So welcome, Kelsey.
Thanks, Joe. So yeah, thank you so much to Aquifer for having me here today. So at our program here, we use Aquifer pretty extensively throughout our didactic phase of the program since 2019, but we're actually fairly new to using Aquifer formally in remediation. So we really just started this past year using Aquifer formally for remediation. So I was going to talk a little bit about kind of how we identify learners first for remediation, and then sort of share an example of one student that we recently used Aquifer for remediation. So a little bit of background, we really use the framework that Kim talked about earlier, so Dr. Garacio's framework. So our faculty advisors and course directors use this to kind of identify the learner area of difficulty and competencies kind of through for a variety of data points. So multiple choice exam scores, assignment scores. We have the students write a lot of SOAP notes and do a lot of oral presentations, and then some of our simulated clinical assessments. And I'd say really the most common area of struggle for our students tends to be medical knowledge, clinical reasoning, which is a part of patient care, and then time management and organization, which is also part of the patient care competency. So I would say thus far, Aquifer has really helped our students with that clinical reasoning competency the most. And previously, to remediate this, in the past, our faculty would utilize paper cases. And so many of you that are faculty probably can come up with some of the challenges of paper cases. So we had to ensure they were always up to date with the medical knowledge. It's very time intensive to write these paper cases, and it requires faculty time to actually go through the paper case with the student that's being remediated. And I think importantly, they aren't peer reviewed or validated cases. And so really in this past academic year, our faculty and our remediation specialists here have turned to Aquifer to really more formally be used in remediation. So the recent development of these Calibrate formative assessments that Joe showed a little bit has really helped us assess some of the medical knowledge that are tied to these Aquifer cases. And so if you go to the next slide, Joe, this is an example of a Calibrate assessment question. So these are written by clinical experts. They're very high quality, they're peer reviewed, and they're clinical vignette style, as you can see here. And at the bottom there, the student can also have the opportunity to note their level of certainty in answering that question. So kind of giving a brief example of how we use this more recently. For a student remediation, we used Aquifer pediatric cases, and we used a Calibrate assessment that was tied to the pediatric cases. So we had a student who had struggled really throughout their didactic years of the program with mostly medical knowledge and clinical reasoning, but they were able to make it through the didactic phase and on to clinical year, and then they failed a pediatric rotation. And so our remediation specialist turned to Aquifer and used a combination of some curated pediatric cases that really aligned with the content from that outpatient pediatric rotation, and then also assigned a Calibrate assessment for the student to take that was connected to those pediatric cases. So this way, the student could work through each of those assigned pediatric cases independently and be assessed on the medical knowledge from those cases with the Calibrate assessment. So both the student and the remediation specialist could review the student's performance on the Calibrate assessment. So if you go to the next slide, this shows that there are identified areas of strength and areas of knowledge gaps that both the student can see on this kind of dashboard profile here, and the faculty or the remediation specialist can also see them. So the student can share these with the faculty member who wants to review these and see these identified gaps. If you go on to the next slide, the student not only can see kind of their global performance on the assessment, but also question by question in pretty granular detail. They can see what questions they missed, what were kind of the topic or target areas. And this, I think, is really critical for a successful remediation, that the learner can identify where they are, and the faculty advisor or the remediation specialist can also identify what are the ongoing gaps, so the support that's offered going forward to the student is targeted and effective. So after all of that, after the student worked through the cases, did this Calibrate assessment, kind of the last step in our remediation process is the student had to complete several SOAP notes and provide some oral presentations that were tied to some of these cases that several faculty members graded. And so that also allowed us to see the student's ability to write a SOAP note, do an oral presentation, and assess some of their clinical reasoning skills. So that's sort of an example of how we more recently have used Aquifer for remediation. So I will pass it on to Cindy next.
Thanks, Kelsey, and thanks to Aquifer for inviting me to join. It's been a great experience. when you're looking for what's that tool, what's the right tool, is there one right tool? It's easy to get overwhelmed. So I was first introduced to Aquifer in 2015 and started using it for remediation at 2016 at Case Western Reserve, where they were big users in the med school. I just started the PA program, and I was motivated to use it with remediation because I found that clinical decision making was a consistent gap in our students' learning process, right? They can get those kind of knowledge tidbits, right? They know factoids, but a lot of times putting it together and coming up with the differential or the management plan, that's where they struggle. So I was looking for a curricular tool that I could use to help teach clinical reasoning skills. And that was standardized because, like Kelsey, we were doing small group, and you've got one instructor developing their cases and somebody else developing their cases, and we have to get together and make sure they're equivalent. And so it was very it took a lot of time. And so this way I knew that Aquifer cases were evidence-based. They were written by experts, they're peer reviewed, they're updated frequently, and they had just such a broad selection. I'm like, wow, this is great. Sometimes, I think when you first enter in, I know it feels overwhelming because now there's neurology, women's health is coming, behavioral health is coming. So you're like, wow, this is great, but it feels like you're hitting an iceberg because there's so much and you don't know how to choose. So just start slow and pick a few cases. But in addition to the signature courses, and as Joe and both Kim mentioned, I love the clinical excellence courses because those are must teach, but hard to teach topics. And, creating a whole course for that, or you talk about something, trauma-informed care, where does that get inserted? And those things just get tacked on, but not in a meaningful way. This way with cases, the students really get much more out of it. So I will tell you some of the criteria that I used as I developed our remediation plan was to not over-assign. I mean, the first, certainly with COVID, I think we all were over-assigning because students don't have anything to do, we'll assign. But you really just do not over-assign. Keep it focused. You can use different cases from different courses and still be focused. So for instance, Family Med, IM, and PEDS have a lot of crossover. So you really can use combinations of cases from those different courses. And what I found that is when you meet with struggling students, even though they'll often focus on one or two topics where they're struggling, they'll say, oh, I didn't know cardiology, or I didn't know heart failure. I always like to choose a couple of cases that focus more on clinical skills because I think students look at clinical topics more than they look at their clinical skills. And we know that history and how important physical exam findings are, or differential diagnosis are. We know how important those are, and yet they kind of overlook those. So I always like to make sure I include a case or two that have that focus on those skills and use the breakpoints that Joe was talking about. I also like to put in some wellness case because, it's our fault because we teach about disease all day long, but we really are providing healthcare. And so wellness is so important, but the students tend to poo-poo it because it really isn't as exciting as learning about somebody's inflamed gallbladder and all the symptoms that they have. And I do think that Aquifer has a great selection of well care across the lifespan. So I think those are some kind of basic tools that I used. One of the things that I use that I like to focus on is the case analysis tool, or the CAT as we call it. And it's a writable worksheet. So if you go to the next slide, Joe, I think you have it up there. So when you, to choose the case, we can go back. Let's go back 2 slides. Yep. So to find the case analysis tool, it's the pediatric course board that developed it. So you see your signature courses, you see PEDS, and then as with all of the courses, there's a little box that say educator resource. If you click on that, next slide, you'll see in pediatrics all the choices, and one of them says pediatric case analysis toolkit. And there's 2 pieces to that. There's the actual toolkit, which for all pediatrics cases, I think for 31 cases, they have the actual the CAT completed, like answer key for you. But they also have a writable, downloadable, document, and you can use it in PEDS, but you can use it with anything. So I use it with any case. And I can make my own answer key or have a discussion with a student. So if you want to use it for a whole course or you want to use it for a whole group of students in PEDS, it's great because you already have those answer keys already developed, but you can use it in anything. So when we had students, again, they struggle in the didactic year, and I think there's many things you can do to help remediate them with Aquifer in their preclinical year as well. But in the clinical year, we used the CAT. And so what we would do is the students get to practice their clinical reasoning skills in an organized and stepwise fashion. So if you go down to the next slide, you can actually see the tool. And so they put their name and they do the patient profile and the epidemiology. And what I really like the most is the tiering, where they're actually forced to look at those cues, those, the problem cue, and decide, is it tier 1? Is this really relevant? Is this really important? Or is it least likely to contribute to my diagnosis? So just as we have to do as clinicians, they have to start filtering information, because I think, remember, students get overwhelmed. They think everything in the case is the same importance. And so this helps them to start to learn to sort and sift. And then of course they make their problem statement, they have their differential, and then they go through each differential. What is your most likely? What are your supporting, your positives from your history and from your physical? So that very logical, stepwise approach really lets them break it down. And then you can choose how to use it. Do you want to have a coaching session? You can use a coaching session. Do you want to use it as a graded piece for a remediating student? And we did that. We would kind of do a combination. We'd meet with them, go over it, do kind of an oral assessment with them, kind of dig deeper and say, well, why did you not choose pulmonary embolism? What physical findings made you go towards this diagnosis? So we can dig deeper and kind of find those areas and those gaps that they may not have self-identified. And then you can use it so we could grade it, but we could also have a coaching session around it. So I think, the CAT really does provide a structure for a one-on-one review with any instructor, and not hard. So some tips for using it is important. You want to establish a schedule and due dates for your CAT to allow both students and the instructor to have the appropriate time for the activity. Know that for each case you assign with a CAT, that it's going to take the student about 60 minutes to do the case and to complete this worksheet. Always remind students to please do it on their own and work independently. And then if you want to use it as a group, so if you're using it in pediatrics, they will tell you that to review and provide feedback on 20 pediatric student worksheets, that's going to take you about an hour. I found that, I can review a student's worksheet in about 10 or 15 minutes, because as Joe said, pick your 6 cases. I always say 4 to 6. Start with 4, get to 6, and know them well. So you know how to go through those worksheets. So you make sure that you give the instructor time, yourself or whoever you're guiding, to do this in time to review the worksheet. Make sure that you really want to do 1 CAT and 1 case per week. You really don't want to do more than that. Remember, if they're in their clinical, they've got all this other work around them. And then remember that you can have this submitted. They could upload it through your LMS system. They could email it to you. You could have them bring a paper copy, whatever way, but it becomes part of the student's kind of record of the analysis of cases. So it's easy. It's there. It's already set up for you. So I found it kind of an easy tool to use. Thanks, Joe.
Thank you, Cindy. So I was thinking about something you said, and if you have any questions, please type them. Oh, I guess Megan's already put that in there. See, Megan's like always a step ahead of me, at least a step, she'd say. All right, so it's, thinking about what you were just saying there, Cindy, about the CAT, and you mentioned breakpoints. Do you often use this with a breakpoint? And then do you have a specific case example where you could, I used the summary statement as a breakpoint, but do you have another one that you think about?
Yes. So I think breakpoints are great. They're really useful to help you assign a certain section of a case and allow that student to focus on the sections where they need to review, whether it's diagnosis, management plan, whatever. And what's nice is as faculty, and Joe, you said this, we can scroll through. So the students are gated. They have to go one step at a time. They can't jump ahead. But because I know it feels overwhelming when you're like, wow, there's like 500 cases in all of Aquifer. How do I even find what I want? You can just look at that. Synopsis is really nice. You can look at learning objectives. You can put in keywords in the search content, like communication, and find those words. So I think that's great. But I think I have found over my many years, 29 years of doing this, that students often feel overconfident in their physical exam findings. So as a PA, we teach the students and medical students, nurse practitioner students, they learn a good physical exam and they feel pretty confident. I've done it. I have this skill. But that doesn't always correlate to being able to interpret physical findings. What happens? What does it mean when you find X on a physical exam? And I think they get hung up on that on assessments or kind of OSCEs, whatever the assessment may be. And so I like to do a break point after the H&P. So having the student, assign like 3 or 4 cases and have them get just through the H&P. And then you can meet and have a nice coaching session, or you can create a written assignment around the physical exam findings. I'm a lover of the family medicine courses, the cases I use. I use them all, but family med are nice broad cases. The first 2 are well care, but then after that, there's a great abdominal pain. There's a good low back pain. That works well. And they have nice differentials. They have like a differential of 6, 7, 8 things, which I think is healthy. You can always throw in the hypertension. Okay, there's not a big differential there, but everybody needs to know hypertension. But again, the abdominal pain, back pain. I had these all written out. I think it's like case 4, case 6. Those are really good cases. And you can there's a lot of physical findings there. And again, you can have them look at those and make those associations. Again, I know how to listen to the lungs, but not understanding what do RALs mean, or what do they not mean, presence of wheeze, non-presence of wheeze. And so I think that's a good place to use breakpoints. I don't know, Kelsey, do you use breakpoints?
I was just going to share one example. I am the course director for our musculoskeletal neurology course. And so we use a case where the patient presents with wrist pain that's pretty indicative of carpal tunnel. And so we have the students actually stop at the physical exam part of the case, and they get into groups and they actually practice a focused physical exam on each other. And it's great because then we as facilitators, faculty facilitators, can walk around and watch the student's technique and say, is that how you're supposed to be doing the Tinel test or the Phelan's test? And then we also can help them identify what elements they're choosing to pick as part of a focused exam, because they struggle with that as learners, right, that they know all the elements. But when I see a patient, how do I decide what's the best focused physical exam? So we kind of use that case as a springboard to have them practice in real time.
Yeah, I agree. Another one is family med. Oh, let me see. What number is it? I had this all set up and I forgot it. It's Family Med 20. It's a 28-year-old female with lower abdominal pain. And the differential is IBS, inflammatory bowel, urinary tract infection, PID, vaginitis. But the final diagnosis is IPV, intimate partner violence, and trichomonas. And what's nice is that thread brings you over to trauma-informed care. So just merging those 2 together is just so nice, because they just get to see that bigger picture. And again, students they want to go quick. They want to find that answer, right? So they hear abdominal pain in a young person's PID, right? And so instead, you're like, ooh, IPV. So a whole different perspective there. And then that crossover, you can do some nice work with the trauma-informed care.
Thank you. We have a couple of questions in the chat. One of them's on the screen right now. And just so we note before we, for those of you new to Aquifer, Cindy has been mentioning differentials And you can, in the content library that I showed earlier, you can search cases by differential. So if that's something that you're interested in doing, you can do that. So on the screen, and this feels like this was kind of how you were closing out your portion a little bit, Kelsey. So maybe you can take this first. How do you use Aquifer for case presentation skills?
Yeah, so I can speak a little bit how we used it specifically for that student's remediation that I gave that example. We, as sort of the remediation team, have already developed the rubrics for both a SOAP note and an oral presentation. So for those old paper cases that we had used, so we just adopted the same rubric for the Aquifer case. So I don't know if Aquifer has a standardized rubric, but we just kind of used our own internal rubric that worked really well still for Aquifer. But we just told the student, you need to work through this case and then meet me at this time on Zoom or in person. And they had to deliver the oral presentation. And the faculty member had to be familiar with the case, but then they used this kind of rubric to grade. We also tended to have at least 2 faculty graders that would grade so that the scores were averaged between the 2 faculty graders, just knowing that everybody's a little bit different in how they grade and interpret oral presentations and SOAP notes. And so that was our method. I'm sure there's other examples, but that's how we did it.
We did it really similar, Kelsey. We used the case analysis tool. So we had them start with their presentation of the case and used the rubric that we have for case presentations. And then we went through and broke it down and said, let's go through the CAT now and let's look at those, let's look at your cues and how did you match those? This was important, this wasn't important, or how did you get your differential? So very similar.
That's awesome. So we're highlighting the question, does Aquifer has a standardized rubric to grade written H&P? We do not, although I don't know if anybody else, Kim or Kelsey or Cindy, have something they'd like to share, the way they do this.
Yeah, we just use our own internal one. Maybe that's something that Aquifer could explore, going forward. But I'd be happy to share with people what we've used. But it's just one that we've kind of developed for our program. We tend to grade quite a lot of SOAP notes throughout our curriculum, and so we've kind of developed a rubric for that we've used.
Yeah, I agree. We have developed our own, although we based it off of a publication out of pediatrics that is probably more than 10 years old now. That I think we can find the resource for that publication and really kind of had to model it based on your own like EMR, local culture type of thing for our expectations for students. We wanted it to be real world, but also kind of in line with best practices. So happy to share those resources.
Yeah, there's an article that came out in 2015 written by some Aquifer volunteers regarding the summary statement. So if you take that summary statement, Sherilyn Smith and several others published, which is actually a grading rubric for grading the summary statement. So they do have points for that. And then there was another one that came maybe a year later out of Canada. The main author's name is Dory. I can't remember the others, and I can't remember the journal on either one of them. But we can try to find those citations and put them in our follow-up email.
And Joe, in the CAT toolkit in pediatrics, the actual toolkit, which is their guide with their answer key, they actually say give points here. So the writable CAT actually has a grading rubric with it. It's like plus points, minus points. That's
right. Thank you. We are at the 2:00 hour, and so we want to note a couple of things. First of all, thank you to everyone who was here today and joined us for this. We really appreciate it. And then thank you to our presenters, Kim Tartaglia and Kelsey Doherty and Cindy Lord. We really appreciate you sharing with us today. You'll get a follow-up email with links to many of the things that we've mentioned in the chat today. You'll also, we'll make sure to include the opportunity to take a demo assessment. It's an 8-question assessment that you can take and calibrate. So if you're interested in seeing sort of what Kelsey's students have been doing, you can take your version of it. It's a much shorter version, but gives you a chance to see it from the student's perspective, and then also the opportunity to sign up for a curricular consult. So if you left this thinking, you know what, my real question is, how do I do this? Or, you know, how can I do more of this within family medicine, remediation or otherwise? We have an option for you to sign up with a member of the team from Aquifer. And then typically we also have a member of the peer trainer board that joins us, either Kim or Cindy or one of the other peer trainers often come to those. Oh, the link is in the chat. Thank you, Megan. Once again, 2 steps ahead of me. But we'll also send that in the follow-up. So thank you again very much. And a reminder that we have another webinar next Tuesday, which is targeting folks that are kind of new to Aquifer and new to their role as either a program director or clerkship director, and how you can get the most out of the tool. So thank you very much.